Okay, so for today's case of the week, I wanted to give you a sneak peek at our anterior BruxZir that we're launching at Chicago Midwinter. All right, thanks for watching. No, that's actually not it. This is the old BruxZir. You know, it's interesting. This material wasn't designed for anterior crowns. Honestly, we designed it for, you know, lower first and second molars, and dentists are the ones who started prescribing it farther towards the anterior, and that's when we realized we're going to need to make this a little more translucent than it currently is. By the way, as you look at this, how else could you ever get 10 totally identical crowns? You know, in the old days, we would have to cut it back and layer it, and there'd be slight variations if we were making crowns for like show models, for models that were going to go to like the CDA show for the exhibits. But now with CAD/CAM technology, we can mill exactly 10 times over the exact same file, looks exactly the same, put a little glaze on it, boom, it's done. And so you can literally get 10 identical crowns, which you couldn't do, of course, in the past. And so BruxZir became an anterior material thanks to dentists kind of asking for it to be used more and more on anterior teeth. And in the beginning, it was a pretty opaque material, didn't have a lot of translucency to it. And as a result, it needed to become more opaque. So it's continued to become more opaque. Today, if you look at all the anterior crowns that we make here at the laboratory, 44% are IPS Emax, which is a really good choice, and 31% are BruxZir, the regular old BruxZir like you see here, which it looks nice, but it doesn't look as nice as Emax. And anterior BruxZir is set to change all of that. It's not as strong as this BruxZir is, but if you've ever cut off one of these BruxZir crowns, you know that it's got more strength than it needs anyway, and so you'll be happy to know it's going to be a little easier to cut the new anterior BruxZir off. But also by decreasing the strength, and it's by manipulating the level of yttria that's in here to stabilize the zirconia oxide. By manipulating that, we've been able to come up with a material that is in fact more translucent, that's being called anterior BruxZir. Now this is a whole arch being made out of anterior BruxZir, and I don't want to switch everybody over to this for all teeth, because again, if you look at traditional BruxZir, this is about 1100 megapascals of flexural strength, and at 1.5 millimeters thickness, that's where we do the hammer test, and you can hit it with the hammer onto the 2x4 and it doesn't cause the crown to break. This is closer to the area of 600 to 630 megapascals of flexural strength. Compare that to Emax at 360 to 400 megapascals of flexural strength. So it's stronger than Emax by about 40%, but about 40% weaker than the traditional zirconia, the traditional BruxZir. So this is still a good material to use on posterior teeth, and you're going to want to continue to use this. But BruxZir Anterior is really just being designed for anterior teeth, and that's when I would recommend that you use it. In fact, it's probably just going to become our default material, where it gets used in the anterior, and in the posterior we would use the regular BruxZir material. I guess unless somebody really said, hey, I've got somebody here who's totally concerned with aesthetics, let's do that. But I don't know how smart of a decision that would actually be. For me, I'm going to be happy with the anterior BruxZir on the anterior, and the regular BruxZir in the posterior. So let's take a look at these two next to each other, if we can, and just see what we notice about the two. You know, if you've been using BruxZir at all, you're kind of familiar with that look on the right. And these are essentially the same shades that you see here, but the difference in translucency, there's just a little more depth to this, and you can see how it would probably be a little easier to use in the anterior and get away with and not have to worry so much to use this BruxZir crown. And I don't really, honestly, I don't use that much traditional BruxZir in the anterior as it stands right now. I'm still using a lot of Emax there, but the anterior BruxZir stands to change all that. And because of the fact that even though it's still plenty strong, you know, it's not as strong as this one, but it's still plenty strong, it's got that translucency and that depth to it that we don't see here. So I will use this in the anterior if we've got a patient who's broken previously existing PFM crowns. I'll use it if we've got a stump shade, for example, on a tooth. If this were an endodontically treated tooth or a tetracycline stained tooth, then I can use this regular BruxZir instead of Emax. But as of today, most of the time I'm using Emax in the anterior because it just doesn't break in the anterior. The posterior can be a different story if the dentist doesn't reduce enough. And Emax is contraindicated in BruxZirs according to Ivoclar, and I tend to agree with that, and that's why BruxZir is actually a great material for people who brux, and hence its name. But with the new, more translucent version of it, I'm going to find myself probably using it more in the anterior than I had been in the past, because it does look better, and while it's not as strong as this one, it doesn't have to be as strong as this one, because the bite forces average 210 newtons in the anterior, 540 newtons in the posterior, so twice as strong in the posterior. So we don't see breakage with Emax in the anterior, and we won't see it with anterior BruxZir either. So some of the doctors now we've been working with, who have been ordering anterior regular BruxZir crowns, we've been sending them one of these as well and say cement whichever one you want to cement. And 9 out of 10 are cementing this one. A few of them still want the strength because they say, oh, the patient's got some real worn down cuspid, so I want to go with the strongest one available. But most of the time, this anterior one's going to be plenty strong. So end of February, we should see this product launch, and you'll start to see some advertisements come around. And I'm happy to say that as well as BruxZir has done in the posterior, we now finally have something that we think looks good enough to put the name anterior onto the product and feel like we can have you prescribe it and use it in the anterior regions and not be worried about it. Like I said, 31% of our dentists are already using the regular BruxZir in the anterior and not having any issues with it in terms of shade. But for me, I've still stuck for the most part with Emax in the anterior, but now looking at the BruxZir Anterior and having been placing it in employees' mouths here for the last year and a half, I think you're going to see that this looks pretty darn good, and it's good competition for other high-strength cementable all-ceramic crowns on anterior teeth.